The breathing skills in birthing better are distinctly different than all other breathing methods that are available in childbirth today. First of all, almost every single childbirth skills method is focused on low-risk women having low-risk births. But 100% of pregnant women are giving birth, and 100% of human beings breathe all the time. And often the natural birth movement, here I am picking on the natural birth movement again, but we need to get this really clear because I've been doing this for a long time. So I know what their messaging is, and I know how this messaging has caused the chaos of today. So Lama's breathing was horrible. It was, couldn't do it for long. We spent a lot of time breathing into paper bags. Bradley was in the nose, out the mouth, which, as you'll discover in the first resource, can sound anywhere from being calm to screaming. In the nose and out the mouth, a lot of different variations on that one pattern. And so what you want to understand is that when the natural birth movement said, cows and cats aren't taught to birth, women don't need to, you breathe now, you'll breathe all the time in labor. Labor is not all the time. It's as simple as that. Labor pains can hurt. And when you see beautiful women beautifully birthing, and people say, oh, she was so instinctual. No, she wasn't. She was consciously using skills. I've talked to tens and thousands of birthing women. Women who are in control are intentionally controlling their behaviors. They will say, I focused on my breathing. You may not be able to interpret that, but I can interpret that now for you. Or I told myself, I kept myself more relaxed. You may not be able to interpret that. I can interpret that for you. That is a woman who is choosing to use skills. And when she is saying, I focused on my breathing, that meant that she chose to breathe either in a quiet way or in a relaxing manner rather than doing this. Simple. The relaxing the body, maybe she relaxed on the outside, but really she learned how to relax on the inside of her body. The difficulty is that people who birth with skills haven't known how to pass those on to people they even know or love. And that's why birthing better skills are so vitally important, is that we absolutely do know how to pass this on. And the way that we did it was deconstructing human behavior. So in the resources, you'll learn about the 4 ways that humans breathe. We all breathe that way. And you'll experiment with the variations of those breathings that we all do the exact same way for the all exact same reasons. And then you'll be able to find the most relaxed breathing. You'll be able to find the most adjustable, adaptable, sustainable breathing. And you and your partner can share that knowledge so that when he or she hears you not be able to maintain that calm, relaxed breathing, they can see and hear it right away and come in and model it for you. That is really, really, really important. The other thing that we discovered about breathing is we can actually direct it. We aren't moving our lungs around, but if we breathe into our belly, our lungs haven't dropped into our belly. It's just that we have the ability as humans actually to breathe in different parts of our body. You can do that now. You can breathe in and expand inside your back and just let it go. That's your ribs. So you can now expand and breathe in and push your sacrum out a little bit as you breathe in, and then soften your sacrum as you breathe out. So we can direct our breathing. So we can direct it. Some women will feel pain in their hip. So they'll breathe in, expand that area, and breathe out and relax that area. The same with back labor, is open up, and that reduces the discomfort. But that's where we couple the breathing with the soft tissue and the bony pelvis and the cervical dilation. So when we breathe in, inhale, you breathe in and you intentionally open up that pelvic lock. So just do that now. Open up the pelvic lock when you breathe in. Feel it open up. And then when you breathe out, just mentally go around and soften inside it. Just soften inside it. Just soften out at that clock face. So lots of us, birthing better moms who are birthing, that's what we do. Every contraction. Every breath in, we breathe in and open up, and every breath out, we soften. The funny thing is that our labor contractions are more effective. Funny thing about that is they can hurt more. They can come closer together. They can be longer and more intense. Funny thing about that, because when we have a more progressing labor, our baby is telling us there's nothing hindering its ability to come down through and out. And then we birth efficiently or effectively, and that can hurt. So we do not have to like labor at all. We just have to do it well. And we do it well by intentionally using skills, even when it hurts like a mother. So this breathing, you will learn all of our birthing better breathing skills.